Hi everyone, and Happy Nurses Month. And yes, because of our standing in the communities across our nation, the American Nurses Association has proclaimed that the entire month of May is the time for us to recognize and celebrate nurses. For those of you who I have not personally met yet, I'm Linda Lawson, the Interim Chief Nursing Officer here at UF Health Jacksonville. It was with tremendous excitement that I stepped into this role following Dr. Patrice Jones' retirement. I would be remiss if I did not acknowledge how much Patrice loved to celebrate nurses. Patrice actually created the committee that we still use today to plan our activities to celebrate you. Patrice, we thank you for that, and we wish you nothing but sunshine in your days of retirement. UF Health nurses, along with our ancillary partners and our provider teams, do make a difference. And I could also go on to claim that nursing at UF Health seeps in and gets in our blood. And we stay for the sheer thrill of what we face and what we can accomplish each day and every shift. But we mostly stay to provide care to the most valuable, yet most vulnerable patients in our city. So for that, we thank you. The association has divided this month into 4 topics. They are self-care, recognition, professional development, and community engagement. We will now hear from some of your peers, their stories about these topics.
Self-care is a priority because I believe if I, as a nurse, don't take care of myself, I can't provide the best care for my patients. So one of the things that I do personally is I start the day with affirmations. That's very important. And also stay connected to my community, stay connected to my church, because I get some of that spiritual nourishment that I need to make me a compassionate person, even to my fellow staff and the nurses that I work with.
For us to be in our best frame of mind, our best physical presence, we have to give ourselves that time. And how we choose to do it, how do we choose to unload, is really up to us. It could be a vacation, it could be just taking a few days off and binge watching Netflix. It doesn't have to be something super special that everyone else thinks. It's personal to you.
We didn't come in the field thinking that we would get recognized for anything, because before being a nurse, I didn't know what a Daisy Award was or anything. So I think that you have to genuinely care about people and want to see people get better and do better, even if you don't get recognized for it.
Because I know how it makes me feel to be recognized, I try to do that for others as well. So when I've served in a leadership position, I would send out weekly Friday emails, and anything that the staff did that was recognizable or above and beyond, I would highlight them in that and just make sure they knew that they were appreciated, and just kind of tell the other staff members what they did, because often staff doesn't always think of that because we're so busy. We have so many tasks, so many boxes to check. So often it makes you think, oh, I can do that.
I run the ED Fellowship. Well, there's 3 of us that run it together, but I'm the lead on it. And one of the things that we do is encourage people to go back for further development. It's really rewarding to me to see the staff grow. I mean, the development is there. The tuition reimbursement is there. If there is someone wants to do something, there is a way to make it happen.
The amount of education that I have had in the 9 months I've been here has been incredible compared to the amount of education that I've gotten long-term in any other place. So definitely feel supported, definitely feel like you guys are invested in nurses and wanting us to do the best that we can.
The heart behind Little Miracles is we're a patient advocate. We want to make sure that moms get early prenatal care.
Nurse Family Partnership, we stay with moms until baby turns 2. So making sure like for them to be self-sufficient, make sure they're taking care of baby, taking them to those well visits. The ultimate goal is to reduce infant mortality, which is what we focus on.
We have a community event that we do twice a year, and it's our baby shower here at UF Health Jacksonville. At our baby showers, we have, of course, Little Miracles, and then Healthy Start Nurse Family Partnership will be there, and then there'll be other vendors that come from outside the community to try to capture moms as well.
I think to better the community, small changes are very important and just gears us to success to empower these moms to be able to take care of themselves and babies. And the ultimate goal is to reduce infant mortality, which is what we focus on.
Like in nursing school, one of my professors would always say they can't pay you enough to be a nurse. You have to actually care because you're gonna see stuff that no one wants to deal with. And I think that it just has to be something in you to care for others and want to see them, do well.
I do hope you recognize the impact that you have on our patients, their family and friends, and even each other. So I want to remind you that you are the face of hope to so many. So for that, I want to give a personal heartfelt thank you and wish you a happy Nurses Month.